Welcome and thanks for being with us. I'm Dan Haggerty. This is the KGW Q&A. During this half hour, we focus on answering your coronavirus questions. Now, the big headline today, Oregon researchers launching a coronavirus monitoring program. A lot of questions about it. How does it work exactly? How will it help? Pat Doris has the answers.
The researchers at OHSU have this wild idea of scattering volunteers all around the state. I mean, they already live there, but they'll identify them and they'll give them thermometers so that they can take their own temperature every single day for a year, an entire year. And 10,000 people in that group will have home coronavirus test kits so they can test themselves every once in a while, even when they don't have symptoms. And that will give the researchers an interesting insight into asymptomatic people. But the folks with the thermometers are going to have those in case they do feel bad. And if their fever kicks in, if their temperature spikes, the researchers should be able to see that in almost real time, because the temperatures will be sent over the internet to the researchers every single day. So imagine having this statewide network of data points, and you can see if something all of a sudden turns red. You send in some researchers, you find out what's going on, give them a test. Are they sick? If they are, you do some contact tracing. Who'd you talk to those people, test them, and it might be a way to confine any future outbreaks. And that's why they're doing it. I haven't heard of anything like that ever in Oregon. It'll be interesting to see how it goes.
Absolutely. Pat, thank you. So I don't need to tell you, there's so many people are out of work right now. And as things start to come back online again, a lot of those jobs aren't going to be there. So a lot of folks are looking for new work right now. Question is, where do you start? Joining us tonight is Jennifer Nolfi, the head for the Retail Leadership Program at PSU's Business School. Let's start with kind of the simple question, who's hiring?
Thanks, and thanks so much for having me here tonight. I think there are industries that are definitely hiring. The healthcare industry, obviously, if you look at the work that our frontline workers are doing there, they're in desperate need for more help. The grocery stores, thank you to them as well in being there for us. But the grocery stores, Fred Meyer, New Seasons, Safeway, Albertsons, they are all really desperate for talent right now. And the jobs are really flexible. So, you know, they're part-time, full-time. Instacart is another one. There's technology companies hiring. So there are definitely jobs out there. I think the real issue is looking at your skill set and figuring out what skills you have that are transferable to those job opportunities.
Let's say you are transferring to something that maybe you aren't currently doing or that you weren't doing before this pandemic. How do you prepare for an interview or something like this? Is there anything outside of just going online and Googling, interview prep questions or something? What can people do?
I think looking at the job qualifications and reviewing your history, there may be things that you've done in past jobs that you've forgotten about that are skills that are completely transferable into this new role. So really reviewing the job qualifications, your skills and experience, and finding those synergies. And then, if there are online resources, if there's some areas that you think you need to skill up a little, whether it's different social platforms that offer training, lynda.com, which offers all sorts of trainings that are free through the library, through the Multnomah County Library, for example, LinkedIn and Facebook. So there's lots of different places you can do shorter term training, or if you want to invest a little bit more time looking at professional and education programs through community colleges, or for example, through our Center for Executive and Professional Education. I think the other really key part is preparing for the interviews. A lot of interviews today are being done via remote, so Zoom and Google Hangouts and others, and becoming familiar with that format. It can be really nerve-wracking for somebody to get on a screen and talk through a computer. So practicing with your friends, trying those different formats out, and becoming really comfortable before you have that interview.
I think a lot more people are more comfortable with that today than they were, a month or a month and a half ago. So it's something I am always curious about is the follow-up after the interview, especially now because even employers that are able to stay open are still dealing with stresses that they've never had to face before. So how do you juggle that communication between being persistent and being annoying?
It's definitely a delicate balance. I think the term we like to use is politely persistent. So you want to follow up with people in a timely manner to let them know how much you enjoyed the job opportunity, and talking to them. You want to show that you're super passionate about the opportunity. So a follow-up email or note immediately after the interview is super important. And then if you haven't heard from them, be mindful that HR managers and recruiters are dealing with a lot right now. And so being patient with them, but following up in a couple of weeks to say, acknowledging that they're going through a really tough time, but that you're still interested and want to work for them and provide value to them. So I think every few weeks or so, it really depends, but just being mindful of what they're dealing with and factoring that into your outreach and follow-up.
Could people use this time right now to kind of build some things that they were looking to build in their own personal, professional lives, professional leadership development? I know PSU offers some programs. What else is out there?
Absolutely. And I think I would just offer that everybody is under a lot of stress right now, people that have work and don't have work. And so really making sure that you're approaching things with balance. So even though you're job searching and you're interviewing and doing all those proactive things, really taking time for self-care is so important, because you need to be mentally ready and resilient through this whole time too. So that balance is really important. Yes, the Center for Executive and Professional Education offers a number of certificate courses on data analytics, project management, and other things. Community colleges are another really good source of resources that I would encourage people to look at. And then there's all sorts of online platforms that are free for different learning opportunities. And it really, I think, depends on whether you're looking for a quick like Excel training, or if you're looking at something that's more significant in terms of the content that you need to master and learn. And so there are so many different options out there to explore. And I just really think looking at going to your library, online library, of course, and then just looking at LinkedIn, lynda.com, and your community colleges are all great resources.
Jennifer Nolfi, thank you so much. We appreciate you taking some time out and talking to us.
Thank you.
All right, we have some good news for those of you wondering when Washington will start reopening, because phase 1 of the reopening plan begins tomorrow. That allows outdoor recreation, including golfing and fishing and hunting. More than 100 state parks and properties will also open for day use. Parking will be limited. They're trying to discourage crowds, so they want some people, but not everybody, to show up. Parks in the gorge will still be closed, and so will Washington beaches. What about reopening Oregon? It will also happen in phases. Governor Brown said rural parts of the state with few or no COVID-19 cases can likely start reopening as soon as May 15th. It's going to take a little longer for counties that have had more than 5 cases. Until we have a vaccine or treatment, Governor Brown says we'll have to physically distance, continue to wash our hands, and, while recommended, wear masks in public. At any time, you can send your questions to us here. There's a number a new one to text. You see it on your screen. 503-226-5088. We'll be answering questions right here at 7 o'clock, Monday through Wednesday. Still ahead tonight, verifying an image you most likely have seen on Facebook about masks. How does wearing a mask impact the spread of coronavirus? And we're also answering your questions about health insurance, like this one. You asked, what do people without insurance do if they want to get tested for COVID-19? The answer, you can sign up for the Oregon Health Plan, which will cover the cost of the test. You can find more information at oregon.gov/OHS. You may have heard some talk of a possible breakthrough treatment for coronavirus. Researchers have seen some positive results in clinical trials with the drug Remdesivir. Providence Medical Center in Portland is one of the hospitals taking part. What did these trials show exactly, and what still needs to happen? We asked Dr. Payal Kohli.
And there were a couple of key findings from the trial. The first is that patients that got Remdesivir actually spent less time in the hospital and got better faster. So it was 15 days for those that didn't and 11 days for those that did. So a 31% clinical improvement, and this was statistically significant. There was also a suggestion towards a lower mortality or lower death rate. So the people that got Remdesivir had a death rate of 8% versus the ones that didn't, their death rate was 11.6%. 96%. But this didn't actually reach statistical significance, so we can't quite hang our hat on it yet, but it's encouraging to see the results heading in this direction. So I'm very cautiously optimistic that Remdesivir has kind of opened the door for us and told us maybe where we ought to focus our scientific efforts in terms of drug development. It's also told us that this drug is doing something. So it's not a cure, it's not a sure thing, but it does decrease the time in the hospitalization, and that's beneficial both for the patient as well as the hospital system as we're talking about hospital resources.
And a reminder, this drug should only be used in trials under medical supervision, so you should not be asking your doctor to prescribe it to you or try to self-medicate. All right, have you seen this viral image saying that masks reduce your chance of getting a virus by 30%? And if everyone's wearing a mask, it reduces your chance by 98%. You asked if that was true. Here's Jason Puckett with our Verify team.
This viral image is showing up a lot in multiple forms, but they all have the same message. They show 3 situations and how likely you are to get sick depending on who wears a mask. If you wear one, your chances are lowered to 70%. If a sick person wears one, your chances are down to 5%. And if both people wear them, your chances of getting sick are down to 1.5%. So, we're verifying. Are those numbers accurate? Our main source, the CDC. The short answer, the numbers aren't accurate, but the idea behind them is. In a statement, the CDC said they can't confirm these numbers, and they don't actually have a real number for how effective cloth masks are. There's just not enough research yet. The only number close to the image was a CDC publication about N95 medical masks. They estimate those filter out about 95% of particles that people breathe out. But the CDC and others are still urging people not to buy those masks as they're needed by medical professionals. So the numbers aren't real, and they give a skewed idea of how effective cloth masks are without any real evidence. But that doesn't mean you shouldn't wear a mask. The image does get one thing right, that masks protect other people. The CDC says cloth masks are, quote, not intended to protect the wearer, but may prevent the spread of the virus from the wearer to others. And that's why they recommend everyone wears them. So we can verify. The numbers in the image aren't accurate, but the idea that masks lower the chances of getting sick is true, especially when they're worn by people who are sick. Got any other claims for us to look into? Send us an email. With your Verify, I'm Jason Puckett.
All right, still ahead tonight, will our warmer weather impact the sun? Now to your questions about Portland's homeless. How are they faring? How are they able to stay socially distant? Maggie Vespa has some answers.
So in short, Portland's homeless are faring better than officials feared. Only 4 people who are homeless in Multnomah County have tested positive for COVID-19, and officials think that number is low because they took action early to keep people apart. Case in point, they opened 2 outdoor shelters along Portland's East Bank, and a third is opening tomorrow at Northwest Broadway and Hoyt. They've also spread beds throughout community centers and the Oregon Convention Center. And that said, we've heard from a lot of you about scenes like this. You worry seeing homeless people in groups on the streets. Well, staff at Street Roots, the paper that covers homeless issues, say they're seeing that too. And they worry it's in part because those who are houseless have a hard time keeping up with all the info and updates tied to the pandemic, and they have a hard time keeping up with best practices. So they've put a guide online, Rose City Resource, and they actually sent out volunteers today with flyers to let homeless people know about this sort of one-stop shop when it comes to info tied to the pandemic.
Maggie, thank you. So as the temperatures are beginning to rise, a lot of you are wondering if it's still possible we could see the number of coronavirus cases drop over the summer. Kristen Severance put that question to Dr. Kavita Patel with the Brookings Institution.
It's still possible. There is still a lot of hope that, like with other coronaviruses, the common cold, as well as the influenza virus, that you see a decrease with warmer temperatures. But keep in mind 2 things. Number one, it doesn't go down to 0. So we're still going to see cases and, unfortunately, deaths from those cases. And then number 2, in the world experience of COVID, we've had much warmer countries where they have had increases in the numbers of coronavirus cases. So the warm weather in and of itself may not necessarily be enough, but we are hoping that in July and August that we do see a decrease, but again, not 0. So it is still a virus that can be deadly, and it is still a virus that if you are high risk or if you are worried about your own health for other safety reasons, we should take as many precautions as possible.
So are you noticing a lot of shortages at the store? Why are they still happening? How long could it be before we see cleaning supplies fully stocked again? But first, another quick Q&A. How are rural areas in Oregon preparing to reopen? Governor Kate Brown has said rural areas that have seen very few coronavirus cases could be the first parts of the state to open back up. Some counties believe they could start opening again in about 3 to 4.
If you are still looking for disinfectant cleaning products, it could be a while before you see them back on store shelves. Let's connect the dots. At the start of this pandemic, there was a lot of panic buying. We all saw the pictures of toilet paper and Lysol wipes flying off the shelves. But at a lot of stores, the paper products are slowly returning. The cleaning supplies, not so much. And people who study supply chains say you can expect it to be like that for a couple more months. The chemicals that go into some popular cleaning products are manufactured in China. And it's not like you can just ship them overnight. It takes about 4 weeks for shipment to arrive. And on top of that, some of those factories in China were shut down while the country dealt with COVID-19. That seriously disrupted the supply chain. Despite that, some of the big companies are still blaming increased demand, saying the shelves are being restocked. People are just snatching up those items as soon as they see them. Meanwhile, at least one supply chain expert told CNN, you probably won't see popular cleaning products like disinfectant wipes for sale on a widespread basis until July or August.
All right, and along with the cleaning aisle, the meat section at the grocery store might look a little lean too. So what are grocery stores doing about it? Joe Ranieri explains.
Over the last couple of weeks, we've been seeing food processing plants from across the country seeing some of their employees contacting COVID-19. With less employees processing those meats, stores are having a hard time stocking the shelves. On Monday, Costco started only allowing 3 items of meat per customer. One plant that's been impacting shoppers here in the Northwest is the temporary closure of the Tyson Fresh Meats plant in Washington State. The company closed late last month so they could test all of its 1,400 workers. So could we soon see a shortage of meat making it to our grocery stores over the next couple of weeks? John Wilson with the Beef Northwest Feeders and Cattle Company in Eastern Oregon says it can take some time for plants to be up and running again, but he doesn't expect to see a major meat shortage.
It takes somewhere between a 10-day, 2-week shutdown, and they've been able to start back up when they've had enough employees again and when they put the necessary interventions in place.
Wilson told me he expects the meat supplies to be fully stocked by the middle or end of next month. Joe Ranieri, KGW News.
All right, thank you so much to all of you for joining us tonight. KGW is, of course, committed to continuing coverage on this coronavirus outbreak. So if you still have questions, which I'm sure you do, our past stories may answer a few of them for you. So go right now to kgw.com/answers to see all of our past Q&As. We appreciate you being with us. Send us more questions. You can email them to us at any time, and we'll work hard to get them answered right here at 7 o'clock, Monday through Wednesday.